So this last session, I think, really demonstrates the multidisciplinarity of what we do. And as you've seen from the program, we have members of the multidisciplinary team from nursing, surgery, radiation, and chemotherapy. I know it doesn't cover everybody, but at least it covers a fair breadth of the multidisciplinary team. So it's my pleasure to invite Susan Acquisto, who is the chair of the Nursing Advisory Board of the Cholangiocarcinoma Foundation, as well as chair of the Bili project.
Well, we had a busy year, exciting year, and I think an exciting year to go forward in 2017. As you see, our Nursing Advisory Board is made up of many of the institutions sitting in this room, and we're certainly recruiting more. And I have the exciting opportunity to go to Thailand this year, so we're hoping to recruit some Thai nurses on our board as well. We do have the dietitian from the Christie Trust Foundation, and as you see, our nurse experts, and we have a PA, Caitlin from the Mayo Clinic. So I feel that we have a great board that we've been working together and always looking for additional members. Our mission really is to advance the scientific knowledge for symptom management, to really enhance the confidence and the competence level of the nurse in taking care of these patients, and really to enhance the quality of life with patients with cholangiocarcinoma. And our group has really been talking of late about the survivorship. As we hear more and more of your presentations and our patients are surviving longer, we really need to be addressing the symptoms of survivorship, because we've been so much into just treating the symptoms of the disease and symptom management that if we can go forward and really talk about that and survivorship. We do have an international multi-institutional collaboration, as well as a multidisciplinary. With the dietitian addition, we are really pleased with that, working on some dietary guidelines. In addition, we're looking for social worker, psychosocial. We already have our medical advisor, Renuka, on our board for the physician component. Really, our clinical nurse practice guideline model, you see it there on the table. We had it distributed on the tables for you. Really was the expertise of the members that came to the table and really had put it in the format of the assessment, interventions, and references, and all based on evidence-based rating. We really want to put this into practice. It's evidence into practice. And our work this year, 2017, is putting these guidelines into practice. And how do we do that? And that's really getting it to the front lines, getting it to the community level, getting it to the institutional level. Really, we envision that you'll just use this as a reference. We would love if you would take it back to your institutions, to your chief nursing officer, to have her review and her nursing team review as a reference, so that perhaps they may put this into practice as evidence-based practice. So really, the result of this, the resultant document that you see before you, an exhaustive literature review, a systematic review of the state of current knowledge, plus whatever we couldn't find in the literature, we had added with institutional practice, and then a consensus among the board, and then, of course, presented to our medical advisory board for their approval. So our 2016 year in review, we recruited, of course, the dietitian from the UK. We developed we finished off the 8 clinical nursing practice guidelines. We did present these guidelines at ASTRO, the annual meeting in Boston in September. We also presented in the European Oncology Nursing Society in Ireland in October of this past year. We submitted our abstract and got accepted for the International Transplant Nursing Society that we will be presenting in June of 2017. So we really wanted to get this out to the public at large and to our associations, respective associations. So you'll see there all of the CNPGs that you have in front of you. Under development, we're finalizing the pruritus guideline, the nutrition management, and then, of course, the management, because we got to be a participant of the Delphi panel. The Renuka headed up, and she already presented during this conference. But because of that, we are going to then follow suit with management of biliary emergencies for the clinical nursing practice guidelines as it relates to nursing. Our 2017 goals Continue with our collaborative publications and presentations. We have already an abstract and our article that we plan on presenting to the Clinical Journal of Oncology Nursing for March 2017. Our international outreach, obviously, with our Thai conference inclusion, as well as our recruitment of other members to the board. We also would like to make so that this does get put into practice. The guidelines that you see there in the booklet, put into quick reference cards so that it's easy for the clinicians to use by symptom, so that you have your racks in your office. You may want to use it as patient education. This will be up on the website so that you could pull it down and print it so that you can give it to patients for patient education. But really, it's really more, these are more about your providers, your nurses, your nurse practitioners, yourself, if you like, your community physicians that you know, that could utilize these practice guidelines as a quick reference. And then we're also going to begin a campaign to facilitate this awareness, create this awareness. We're going to start it on Giving Tuesday in November. So instead of really giving money, it's really going to be given the gift of awareness. And the awareness will be Give Me 5. And we'll have to credit Renuka. She's our ideal woman to the max, and sometimes she has so many ideas. We say, "Wait, Renuka, wait, we can't keep up with you." So she is fabulous on our team, and we're so lucky to have her. But it's a Give Me 5 campaign. So what we will be doing is asking our physicians, our expert physicians, sit in this room for 5 community hospitals or 5 contacts that you deal with at the community level that we could get this information out to for the quick reference guides. So we have a busy year ahead, and thank you. Any questions?